thought I'd give you a little bit more information. I think I said earlier on the vitamin D that you're supposed to take it once a week for 6 weeks. So make sure you remember that if you're put on the vitamin D. Emotional issues. Fertility treatment is a long uphill road. The path leading to acceptance of donated embryos is even more mountainous than the one you currently travel. Most people facing embryo donation as a therapeutic options are not newcomers to fertility treatment. Receiving discouraging news may have been the rule rather than the exception during the course of your journey. Even so, when you use of an embryo donation may be one of the best treatment options. Most people experience a myriad of emotions. Some feel shock, disbelief. Some express anger, and others may feel desperate or hopeless. Most people have many questions, including why me and how can this be fixed. Some people have difficulty adjusting to the ideal of they will never have their own genetic child. Many people experience feelings of ambivalence, confusion, fear, grief, inadequacy regarding their role in pregnancy and the parenting process. Understanding and acceptance of these feelings are normal. It's essential to being a good parent. It's not genetic. Parenting it's an acquired skill through years of practice, a fierce desire, and a great deal of love. Parenting may be learned, but it's never perfected. No one is perfect. Nobody knows it all. They highly recommend the services of a counselor if you need one, especially trained in working with family issues to help you work through these feelings. The art nurse will happily help arrange appointments with one of the counselors. The nurse will be happy to arrange that for you too. After you have taken time to discuss your feelings with each other, we encourage you to schedule a return appointment with your physician. It's helpful for them to organize. It's helpful for us to organize our thoughts, our feelings. Write them down. If we have any questions before we see the doctor, write it down. That way we are ready to ask those questions when we get into the office and not say, oh, wow, I didn't get to ask this question. Well, write it down. The ART fertility program, the recipients usually has a waiting time during which preliminary tests are performed and suitable embryos are made available. Embryos may become available from those patients who have completed an in vitro fertilization cycle and have preserved excess embryos. Many desire to no longer store their embryos and may have experienced mental incapacitation, death, divorce, separation, or the embryos may have been abandoned, and SIS, which is sonar insufflation study, HSG, and or hysteroscopy will be required within 6 months of the embryo donation cycle. The waiting period is based on the availability of the embryos and often will be longer than a year. Many express that reaching the decision to move the embryo donation gives them a sense of relief. They welcome the waiting time as a chance to adjust. We all have a period of adjustment we have to go through. to refocus our lives to one without monthly fertile treatments. They wait for embryo donation with a new sense of hope. After being placed on a waiting list, some patients and their ART physician agree that they may contain fertility treatment utilizing ovulation induction, timed natural cycles, or in uterine inseminations. Even though the chance of pregnancy may be low, some find the process helps them complete their emotional adjustment to the embryo donation. Potential for pregnancy, your ART physician will discuss with you your potential for pregnancy rate based on the quality of the embryos stored, as well as other contributing factors. Once you make the decision to use an embryo donor to help achieve pregnancy, you are usually anxious to begin. I know I am very, very anxious. I cannot wait. Preparation of the recipient woman's uterus is one of the keys to success in the egg donation process. The uterus, the test, are required to assure both parties that are healthy and do not have communicable diseases which could be passed to the fetus. The ART nurse coordinator will help you arrange these tests. The cycle process, the potential embryo recipient must be referred to the embryo donation program by one of the ART physicians. Previous medical records should be sent to the ART fertility program for physician's review before the first appointment. These records should include results and information regarding both partners. If you've had any previous fertility tests, treatments, previous surgery, illnesses, hospitalizations, previous pregnancies, any lab tests that you've completed, or any list of allergies that you have. Your partner's information should include his blood test, his previous injuries, illnesses, surgeries, or hospitalizations, a list of all medications being taken, prescription and over-the-counter, and a list of allergies, if there are any. Like with my case, I'm allergic to codeine. I can't take codeine. It makes me break out in hives, itch, I throw up, and but it is not possible to state with any degree of certainty or specificity the psychological implications of participation as recipients of donated embryos in the embryo donation program. The recipients should have a consultation with a mental health care provider during which the psychosocial issues surrounding embryo donation and the possible implications are discussed. Excuse me. Once your screening is complete, an embryo donor's profile, including donor characteristics, will be sent for review. In other words, they can find a donor that's close to what you would look like. Say, if you want brown eyes, blonde hair, you want a white baby or you want a black baby, it doesn't matter. They're gonna do what they can to get you through it. Usually the pregnancy test is performed approximately 9 to 12 days after the transfer. Some medications are continued until pregnancy results are known. If the recipient is pregnant, she will continue on all of her proestrogen medications, estrogen. You'll keep doing you'll keep taking all your medications for vitamins, everything. I just hope that everything works out. I know that it will work out, and we just got to give it time. But when you go through all of this, you better be expected to sit down and read a lot, because that's the only way that you are going to learn. I figured if I did my own documentation, it would help me. It would be a lot easier. Sorry. But, it's been a long, hard process, and I hope that any information that I have given you helps you. And if you need someone to talk to, I'm on Facebook, Loretta DeMint, and always just click on my name, and if you need a friend, put in a friend request, and I will be your friend. And if you need any information on this, I'm more than happy to help you. Well, I've said enough for today. I think I'm going to take a nap. Y'all have a good one.